So I am Jamie Bazook. I'm an Associate Vice President for Hyland Software out of the United States, out of Cleveland, Ohio. And I oversee our EMEA and Asia Pacific divisions for healthcare sales.
Great to have you here at HIC in Australia. Tell me a little bit more about what brings you here.
Absolutely. So we have done quite a bit of investment in the Hyland brand here, specifically in Australia. And we are working with a lot of different hospital systems as well as at the state level on their enterprise strategy in terms of EMR integrations, their medical imaging, et cetera. So we are here to kind of advertise the brand a little bit more, as well as work with a lot of big enterprise deployments.
Yeah, I feel like quite a few will know of the name Hyland and then go, oh, maybe you do this or maybe you do that. So, I'd love to know, from your side.
Absolutely. So Hyland originally started in document management, enterprise content management, pick your flavor of term for that technology. And that started in 1991, originally actually in the banking industry in the United States, just scanning checks. Literally, that's how the company got started. So very small, actually. And then in the late 90s, Hyland developed a healthcare vertical. So we're very vertical, multiple industries within Hyland. I only work within healthcare, and I have over the last 20 years. And since about 2000, we've had our healthcare division, which is by far our largest industry from an employee revenue, customer count, et cetera, across the globe. And we have offices around the globe. We're about a $1.2 billion private recurring revenue company, tech company, and about 4,000 employees.
Wow. And so here in Australia, you touched on a little bit too. There's this working with individual hospitals, but also at a state level. I'd love to learn a little bit more about what the states are requiring and what you're doing.
Yeah, it's quite interesting, and it's a very different model than what we would see in the United States, which is the difference really between public and private, in my opinion. But here, take Queensland for example. So eHealth Queensland is looking at large statewide single enterprise imaging, repository of content so that they have a single source to store all their medical imaging. So all of your x-rays, CTs, MRIs, et cetera, has a single storage spot, and that is accessible for anyone across the state that has access to that repository. So I'm talking about a vendor-neutral archive that all of our packs, all of the different various packs would feed into, and that allows for sharing and accessibility. One of the unique programs that Metro North facility is working on is a telestroke. So if I am a patient and I'm at a rural location or I'm out on an island somewhere and I have a stroke, what happens, right? So I get my CT, and then what happens? Is this a true emergency? So what this telestroke program is looking and doing is that image through our software will be provided to a provider within Metro North facility. They will do the read, and then they will provide consultation in terms of put this patient on a helicopter immediately. Let's do this clinical workup. Let's work with these meds. So whatever that is, and it allows us to not only surface that image quickly, but we can also then route it to the right provider. Who needs to read this, and how fast do they need to read it? Somebody on holiday.
Yeah. And here at HIC, there's attendees, get to know obviously what's happening over at the booth, but I understand there's also stuff happening on a stage somewhere too.
Absolutely. So Dr. David Anderson from Metro North is here, and he's going to present Metro North's vision for the statewide plan for state of Queensland in terms of how are they doing their strategy and what is their app rationalization and having, enterprise imaging, for example, as that one source system, so they don't have, every hospital doesn't have to have a different vendor with a different PACS environment and, a different way to read their images. And so they are going to give a presentation tomorrow about what their strategy is, why are they doing it, the benefits of that. And so Hyland plays a pretty significant role in that. A lot of it is our technology. We're not the only vendor at play here, of course, but it's a massive ecosystem of other vendors that really need to play nice, right, for the benefit of the patient, the benefit of the healthcare system.
Interesting. And lastly, given that you'd be seeing a lot about what's happening across the breadth of, different regions around the world and what's happening in the US compared to what's in Australia, what's exciting you the most, and what can we look forward to maybe in this region, but also just out of interest, what's happening in other parts of the world?
In this region, the adoption of mainstream or Western vendor EMRs like Epic. So, for example, New South Wales purchasing a statewide EMR, right? So for all 228 or so facilities, having one single instance, which I'm being told is the world's largest instance of Epic, will be installed for New South Wales. So quite exciting, and we're working with the state for the imaging side, for the content, the unstructured content side of that. There's actually quite a large portion of content that's not stored in Epic. It makes up your medical record. That could be imaging, could be all your unstructured content coming in from other facilities. And we make up a massive portion of that content as well. So really, again, kind of going back to, a village of vendors. It really takes a village, right? Of vendors, it's, long are the days of just having one sole provider that can handle everything your healthcare system needs. And so that's a big theme for us now, and doing it at a state level allows us to work across an entire enterprise instead of at a single hospital and trying to work our way up to get everybody to see that vision.